Welcome to my YouTube channel. Today's topic is obsessive compulsive disorder. Obsessive compulsive disorder is a condition in which you have frequent unwanted thoughts and sensations that cause you to perform repetitive behavior. The repetitive behaviors can significantly interfere with social interaction and performing daily tasks. OCD is usually a lifelong chronic condition, but symptoms can come and go over time. Everyone experiences obsessions and compulsions at some point. For example, it's common to occasionally double check the stove or the locks. People also often use the phrases obsessing and obsessed very casually in everyday conversation. But OCD is more extreme. It can take up hours of a person's day. It gets in a way of normal life and activities. Obsession in OCD are unwanted and people with OCD don't enjoy performing compulsive behavior. What is the difference between OCD and OCPD? Even though they share similar, obsessive compulsive disorder and obsessive compulsive personality disorder are different conditions. OCPD is a personality disorder that causes an extensive preoccupation with perfectionism, organization, and control. People with OCD are usually aware that their obsession and compulsions are problematic and accept that they need professional help to treat the condition. People with OCPD usually don't think there is anything wrong with their behavior and beliefs. This is the difference. Who does OCD affect? OCD can affect everyone. The average age of onset is 19 years. About 50% of population with OCD begin to have symptoms in childhood and adolescence. It's rare for someone to develop OCD after the age of 40 years. It affects before 40. How common is obsessive compulsive disorder? Obsessive compulsive disorder is relatively common. It affects 1.6% to 2.3% of the general US population. What are the symptoms of OCD? The main symptoms of OCD are obsessions and compulsions that interfere with normal activities. For example, symptoms may often prevent you from getting to work on time, or you may have trouble getting ready for bed in a reasonable amount of time. You may know that these symptoms are problematic, but you cannot stop them. Symptoms of OCD may come and go, ease over time, or worse over time. These are the symptoms of OCD, obsessive compulsive disorder. Obsession in OCD. In OCD, obsessions are unwanted, intensive thoughts or mental images that causes intense anxiety. People with OCD cannot control these thoughts. Most people with OCD realize that these thoughts are illogical or irrational. Common examples include fear of coming into contact with perceived contaminated substances such as germ or dirt, fear of causing harm to yourself or someone else because you are not careful enough or you are going to act on a violent impulses, unwanted thoughts or mental images related to sex, fear of making a mistake, excessive concern with mortality, feeling of doubt or disgust, excessive concern with your sexual orientation or gender identifying, need for order, neatness, symmetry or perfection, need for constant reassurance. Compulsion in OCD. Compulsion is OCD. In OCD, compulsions are repetitive actions that you feel like you have to do to ease or get rid of the obsessions. People with OCD don't want to perform these compulsive behavior and don't get pleasure from them, but they feel like they have to perform them or their anxiety will get worse. Compulsions only help temporarily through. The obsessions soon come back, triggering a return to a compulsion. Compulsions are time consuming and get in the way of performing activities that you value. They don't have too much the contact of your obsessions. This is the compulsion in OCD. For example, arranging things in a very specific way, such as items on your dresser, bathing, cleaning, or washing your hands over and over, collecting or hardening items that have not personal or financial value, repetitively checking things such as locks, switches, and doors, constantly checking that you have not caused something harm, constantly seeking reassurance, rituals related to numbers, or excessively preferring or avoiding certain numbers, saying certain words or pairs that doing unrelated tasks. Compulsion can also include avoiding situations that trigger obsessions, for example, in refusing to shake hands or touch objects that other people touch a lot, like doorknobs. These are the examples of compulsions in OCD. What causes OCD? Researchers don't know what exactly causes OCD, but they think several factors contribute to the development, including genetics and brain changes. Genetic studies shows that people who have a first degree relative biological parents or sibling with OCD are at a high risk for developing the condition. The risk increases if the relative developed OCD as a child or teen. Brain changes. Imaging studies have shown differences in the frontal cortex and subcortical structures of the brain in people who have OCD. Obsessive compulsive disorder is also associated with other neurological conditions that affect similar area of the brain, including Parkinsonism disease, Tourette's syndrome, and epilepsy. PNDS syndrome, PANDAS, is short term of pediatric autoimmune neuropsychiatric disorder associated with streptococcal infection. It describes a group of conditions that can affect children who have had strep infection, such as strep throat or scrap fever. OCD is one of these conditions. Childhood trauma. Some studies shown an association between childhood trauma, such as abuse or neglect, and the development of OCD that is related to childhood trauma. How is OCD diagnosed? There is no test for OCD. A healthcare provider makes a diagnosis after asking you about your symptoms and medical and mental health history. Providers use criteria explained in the Diagnostic and Statistical Manual or Mental Disorder 5th edition DSM-5 to diagnose OCD. This criteria includes having obsessions, compulsions, or both. The obsessions or compulsions take up a lot of time. The obsessions or compulsions cause distress or affect your participation in social activities, work responsibilities, or other life events. The symptoms cannot caused by substances, alcohol, medication, or an other condition. The symptoms are not explained by the different mental health conditions such as generalized anxiety disorder, eating disorder, or body image disorder. This is the criteria for the diagnosis of obsessive compulsive disorder. How is OCD treated? The most common treatment plan for OCD involves psychotherapy, talk therapy, and medication. If this treatment does not help your OCD symptoms and your symptoms are severe, your provider may recommend it transcranial magnetic stimulation. Psychotherapy for OCD. Psychotherapy, also called talk therapy, is a term for a variety of treatment techniques that aim to help you identify and change unhealthy emotions, thoughts, and behaviors. You work with a mental health professional such as a psychologist. There are several types of psychotherapy. The most common and effective form for treating OCD include cognitive behavior therapy, exposure and response prevention, and acceptance and commitment therapy. CBT. During CBT, a therapist will help you examine and understanding your thoughts and emotions over several sessions. CBT can help alter harmful thoughts and stop negative habits, perhaps replacing them with healthier way to cope. ERP is a type of CBT. During ERP, a therapist expresses you to your fear situation or images and and has you resist the urge to perform a compulsion. For example, your therapist may ask you to touch dirty objects but then stop you from washing your hands by staying in a fair situation without anything negative happens. You learn that your anxious thoughts are just thoughts and not necessarily reality. ACT helps you learn to accept obsessive thoughts and just thoughts, talking the power away from them. An ACT therapist will help you learn to live a meaningful life despite your OCD symptom. Psychologists help you for the treatment. Thank you so much.